Okay, so this model actually is missing third molars. However, we're going to start with what we have, okay? Maxilla, mandible, molars. This is permanent dentition. This is a canine. These are incisors. These are lateral incisors, central incisors, and then they repeat on the other quadrant. So when we talk about in dentistry, we talk about quadrants. We have that imaginary line that goes down the middle, right? So you're going to separate the teeth into quadrants. So you'll go upper right quadrant, upper left quadrant, lower left quadrant to the midline, lower right quadrant. Does that make sense? Okay. So in a universal numbering system, it's going to go from 1 to 32. You'll start here on the maxilla with number 1, although number 1 is not represented in this model. It's missing. You'll start with number 2 on here. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Right? And then again, there's no wisdom tooth in this because it's not represented in this model. Lucky us, maybe we won't have to instrument that one, right? You get down to the bottom, you're going to start on the lower left, and you'll have 17, right? 18, 19, 20, 21, 22, 23, 24 is your midline on the mandible. You'll go to the lower right quadrant and you'll start 25, 26, 27, 28, 29, 30, 31, 32 will be your last.
So we skip for wisdom tooth.
Because they're not represented in here, right? Because we don't have them. So we're just going to pretend that these are extracted. We're going to pretend that the oral surgeon came in before we did and took all third molars out. But we're going to say this person's over the age of 25 and they were in college and their wisdom teeth started to hurt and they had to get them all pulled out, right? So since they're not represented, we can't count them. So what you would do in a charting situation in that particular instance is you'd actually chart it as missing. You chart it and you would ask the patient, did you have your third molars removed? Most of the time they already know. Yes, I did. I had those removed 2 years ago, last summer, 3 weeks ago.
I have something to know right now.
You did?
Yes.
Okay. You're gonna be when you start counting those teeth. That'll be fun. That'll be fun because your partner will be like, oh, you're missing that tooth. That's so cool. Well, let's take a radiograph of that. Do you have anything underneath that? So that'll be fun. That'll be kind of a good challenge. So international system. Yes.
Which one is the third molar?
Third molar is the very last molar that erupts in the mouth, if it erupts at all. So your first molar is the first molar closest to the midline, and as you work your way back towards the posterior, you'll call them first, second, and third molars. Does that make sense? And they're in all quadrants. First, second, third. You do the premolars the same way. First premolar is the tooth closest to the midline, right? Second premolar is the one back further posterior away or towards the back of the throat. Does that help? Midline is, you remember where the midline is at? It's an imaginary line that splits the teeth in the middle. You also have a horizontal line that goes this way. So you can call it a mid-sagittal plane if you prefer. Does that make sense for you guys since you took anatomy?
Yeah.
Okay, so we'll call it the mid-sagittal plane if you'd like to do that. And when you take a panoramic, they'll call it the mid-sagittal plane. That might make more sense. However, clinically, they're going to tell you, you're going to talk about it in the midline aspect. Okay? Just so you know. So international system. The reason I told you about quadrants and the universal was so you could be thinking about this in the international. Quadrants, and that's why we talked about the midline, right? So your midline is down through mid-sagittal plane, and then you have your transverse plane that kind of separates the maxilla from the mandible. So then you have 1, 2, 3, 4 quadrants, right?
So it goes right, left, right.
Yes, exactly. You got it. And so you'll number them in that order. 1, 2. Now remember, you're looking at me backwards. So look. Imagine me facing this way. 1, 2, 3, 4. So, or sometimes when I first started hygiene school, I had to do that. I had to think, okay, where am I talking about? So I don't know why that helps me, but it did. I had to turn my face around. There are still some instances when I'm taking radiographs, I'm like, okay, now what am I doing? And so I'll go back to that. So whatever helps you remember that, if you have to turn your face around to help you remember that, do that. Do that 20 years later. Right, left, right, left. So in the international, for the universal, it's right, left, right. Right, left, right.
Okay, so you start
Upper right, patient's right.
Okay, so not
It's backwards. So just pretend like so you're looking at the patient and you're talking, and the patient goes, "Oh, my tooth hurts over there." That's pretty easy, right? But if you're talking to a doctor and say, "Okay, she's got a toothache in the upper," and we think it's the upper left, but she points up here, and you're thinking it's over there. Doctor's going to go on the other side. Yeah. So that's really important. You distinguish those. Okay.
We have to put ourselves in an anatomical position.
Pretend like you're sitting on the patient's tongue, looking out. I know that sounds really disgusting, but that's you can do that. Does that help orient you a little bit better?
Yeah.
And then you can start, and then you look up towards the back of the tongue. You're like, "Hey, that's the third molar, second molar, first molar, second premolar, first premolar, canine, lateral incisor, central incisor," and then it starts all over again in the upper left quadrant. And you're like, "Hey, I'm taking a tour of the mouth." Pretend you're the tongue, or you're on the tip of the tongue. Okay. Does that help? Mm-hmm. All right.
Yeah.
So your international system is very easy. I took your chair. Okay, fine. So international system is in those quads, right? What's your upper right quad then gonna be? If you start there with your universal numbering system,
1.
so it's quadrant 1. Okay. And where do you move to in the universal numbering system? To the upper left.
Yeah.
So then, what do you think this quadrant's gonna be? Okay. Then where do you move to in the universal numbering system?
Down.
3, and then where?
4.
There you go. Does that help?
Yeah.
Follow your universal. Get your universal first. Follow your universal numbers and think about, okay, I'm here, I'm going here to here. And then that international system will be a breeze. And then all you have to do after that, once you know the quadrants, is everybody comfortable with the quadrants? Got it? 1, 2, 3, 4. It takes a few minutes. It'll sink in. It'll sink in later, I promise. And you'll be like, "Oh, yeah. It's just backwards. So you always have to pretend like you're looking in a mirror. Now that you know your quadrants, start your numbering system front to back.
Yeah.
Okay. So these are your central incisors, the big ones here in the front. The one, and that's number 1 on both quadrants and in both arches. So 1, 1, 1, 1. What's going to differentiate that if I'm talking to the doctor?
The number 1, 2, 3, 4.
The quadrants, right? So you're gonna talk to the doctor and say, "Okay, which quadrant is that?" 1 quadrant, and I'm talking about the central incisor. So which tooth is that?
1,
1, 1. What if I'm talking about the lateral incisor?
1, 2.
How if I'm talking about the canine?
1, 3.
3, yeah, all the way to 8, because you have 8 teeth in each quadrant, right? So what's going to happen if you're talking to him about the lower left canine? 3, 3. Yeah, because you're starting at the midline, central incisor, right? To the lateral incisor, to the canine. So 1, 2, 3, and you're going to work your way back. You're always going to work from the midline back on your international system. Okay. Same thing with the palmar. The only thing with the palmar that's different is instead of the number quadrant, you use the line.
Okay.
Okay, so again, put yourself on the patient's tongue. Look around, whatever you have to do, draw the line. I have to look around. Even when I'm talking to you guys, I'm like, okay, now which way is that? Did you see me when I was doing my paper? I still do that 20 years later. So it really helps. Whatever you have to do to make that happen, make that happen. You don't want to mess up on a patient. If you're not sure, tell them the universal number of the tooth. Okay. That's the one you're going to use.